and I'm going to hand it off to Juliet.
Hello, and I know that we're doing this in the middle of your lunchtime, so feel free to continue snacking and eating as you need to. My name is Juliet Rousseau. I'm with MDHHS, and thank you for the introduction, Kira. Um, I have been with MDHHS for going on 13 years, I believe. I started out at Kalamazoo Psychiatric Hospital, then moved into child welfare, and now I am currently with our section. It's called Workforce Access and Grants Management. And Kira's right. This is a bit of my baby. I'm very enthusiastic about this new program. It is different from the NHSC, so you'll see some things that are different. But if you are familiar with some of our other programs, you might see some similarities. I am going to turn off my video and share my screen so that we can go through this presentation. And just so I get an idea of who's out there, if you choose the React buttons at the bottom, if you are an employer who's interested in learning more about the Nurse Loan Repayment Program, can you choose the thumbs up React? And then it gives me an idea of who's an employer. If you are an applicant interested in this, can you do the heart emoji, please? So I can just get an idea of who our audience is. Okay, so a good mixture. It looks 50-50 to me. Thank you for reacting. It kind of gives me an idea. And let me turn off my video so it's not distracting from the presentation. All right. And I'm not as familiar with Zoom, so please be patient with me. And hopefully you all can see my screen now.
Yep, you're good, Juliet.
All right, perfect. Um, this is for the Nurse Loan Repayment Program. This is a new program geared towards nurses in general. And if you are familiar with our MSLRP program or our My Kids Now, this is very similar to that, but it is geared towards our nurses. The goal of this program is to keep excellent nurses in areas that really need them. So their debt might be a barrier otherwise to them staying and working where we would love them to work. Um, so this is what we're hoping to solve. And these are the types of nurses that are eligible for the Nurse Loan Repayment Program. We've got a variety of RNs as well as LPN. Who are not eligible for this program are CNAs, are CNAs, or nurses that don't have active licenses or they have a temporary license or pending licenses. Or if nurses aren't sure that they want to stay with their current employers for the duration of their service obligation with an LRP. So if they're not willing to stay for 2 years, this isn't the right time for them to enroll in this program. And then we have some priority applicants. Again, this isn't eligibility, this is for priority. Funding will be allocated to eligible nurses who meet one or several of the priorities, but it's not the end all. So for priorities, it just bumps them up kind of to the top of the list. And some of our priorities are based on practice sites. Um, these are some of the practice sites that are priorities. So state psychiatric facilities, if you work at the public schools, if you work at a tribal health and SUD clinic, CMHs, CCBHCs, and so on. Or if you are a teacher at a school of nursing, you also are part of this program and a priority. And then we also have those employed within the high social vulnerability index counties. There are 21 counties. So if you are an employer who has practice sites in these counties, then you would be able to check that, yes, this is a priority practice site. And they would get evaluated first and perhaps receive funding if they're eligible in all ways. So if you're in those 21 counties, you're also a priority applicant. There are also ways that an applicant, not based on their practice site, can be a priority. So those who are underrepresented in their areas, or if they're multi or bilingual, and that is on their Part A form, and that's not something the employer has to mark. That's something the applicant themselves has to attest to. So our application cycle opened on the 30th. We've had a lot of interest and a lot of applications come in. It closes June 4th. I can tell you right now that we've received over 600 applications. So we're very excited about the outpouring of interest in this program, and we're hoping that we can really help those nurses who want to stay in these areas. Um, so a little about the service agreements themselves. So the Nurse Loan Repayment Program, you're signing up for a 2-year service agreement, and it starts October 1st of this year, and it goes for the 2 years. So there is a bit of a difference for the priorities. If you work at a state psychiatric facility, applicants who are awarded, they're eligible for student loan repayments up to $300,000 over 4 years, which is a 2 service agreements back to back. And then for everyone else, it would be $300,000 over 10 years, which would be 5 service agreements. And right now, we don't know how many years this program will go for. We only have funding allocated for this original 2-year service agreement. But this is the possibilities. This gives you a way to sign up for future updates. So if we do run another application cycle, or if you want to receive more updates about the Nurse Loan Repayment Program, this is a great way to sign up. You can use this code, or you can sign up for a form online and you will be added to our email blast. So let me stop sharing. We do have a website. It's michigan.gov/NLRP for the Nurse Loan Repayment Program. So you can go to that to learn more about it and get the details. But I know some people have already had a chance to review all of that and have some questions. We've been receiving emails asking specifics and different things like that. So Kira was kind enough to reach out to everyone to see if a lunch and learn would be a possibility, which thankfully it looks like several people are interested in this. I've given you a brief overview of the program. I would love to know what questions you have.
Was asking if you wanted to peek at his legs and do talk about the dressing. Good. I didn't know if you wanted to.
Does anybody have any questions for Juliet? Now would be a great time to ask. How do we know if our employer is signed up is one of the questions in the chat.
Okay, we can definitely talk about process. So, pardon me. If your employer is a nonprofit, then they're eligible as an employer. They don't have to be part of a HIPSA, though that helps. And they don't have to be one of those priority practice sites, though that does help an applicant get kind of pushed to the top of the list. But if your employer is a nonprofit in Michigan, then they are eligible. What I recommend people do, applicants that are interested, I think you should start with an honest conversation with your employer, and they need to be honest with you too. And you have to discuss, I'm willing to stay for 2 years. This is what I'm committed to. I would really like help with this program. Would you be willing to sponsor me? Now, the employer has to be also willing to employ you for 2 years. And after you've come to that agreement that everyone's okay with that, that means that the applicant can get started on their Part B form and gain that filled out by their loan servicer and submitting that as well as their Part A application to me, which is online. And then the employer goes to their online application and can submit their form. It's called Practice Site and Declaration of Intent, and it's just gathering the information and confirming that the employer is willing to sponsor you. There is no funding match for this program, so the employer does not have to put any financial match towards the employee or the applicant, I should say. So financially, it's a very low risk for the employer, but they do have to be willing to sponsor you for the 2 years service agreement. So the service agreement starts on October 1st of this year and goes until September of 2027. Um,
Juliet,
that is in general the process.
perfect. So we're getting a lot of questions in the chat. I'm just gonna go down in the order we receive them. We can tackle them one by one, but we have in here that there's a question about whether or not public health departments are a priority as well. Is this true or not true?
Yes, they are. They're on that list of priorities.
Perfect. And then can nurses use their professional MI login for third-party portal to submit their application?
No. So if you, as an applicant, already work within the My Login for your business, you need to make a personal account. I do have a step-by-step guide on how to do that for people. So if anyone needs that link, then I can just email me and I'll share it with you. And it gives you step-by-step screenshots of how to sign up for a personal My Login so you can upload your Part B as an applicant when you're ready.
This next question, this is a good question. So if they currently, if a health system or a clinic has no staff with loans to repay, then there's no reason to sign up. It's not something that they can kind of apply for to use in future hiring. Correct?
So kind of. I would say if you're currently recruiting and you plan to hire someone before October 1st, you can make that agreement with them as a form of recruitment that you would sponsor them through this program, and that might help you recruit some really amazing individuals. So in that case, even if their hire date isn't until October 1st, you can still have them apply and you can use it for a recruitment. But no, this is not for future years at this time.
Next question. There's somebody taking a look at the application and they see that the first question is their filed transfer area system username. Is that what they are using to log in, like MCIR?
So that is what I was talking about. It's through the My Login. And I do have a step-by-step guide of how to do that. That is how you will be uploading your Part B, which is from your loan servicer. And I need that on your Part A, which is the online part, so that I can match up your Part B when it's time. Otherwise, we'd have a whole bunch of forms with no way to pair them to the applications. So if you want to give me an email, I can drop my email in the chat as well, so it's easy to grab. Just let me know that you need the step-by-step guide. It is also available online on our website, but for ease, if you want to just email me, I don't object.
Perfect. I lost my spot. There we go. Can you explain the $300,000 over a 10-year or 5-year service agreement? Is that a 10-year commitment?
So, yeah, I know that that language is confusing. We have to mention that because that's through legislature. So it's still a 2-year agreement, but that's how we calculate the amount your award would be. So let's say you have $100,000 in eligible student loan debt. Um, so that would mean that we would have to divide it by 10 and then times it by 2, which is the amount of service agreement years, the 2. And you'd we have a minimum amount of $20,000 that we'll be funding. So pretty
Yeah.
much anyone $100,000 or below would get the 20,000, who is eligible, I should say, would get a $20,000 2-year service agreement.
Thanks. See ya. Have a good weekend.
If and then also if whoever asked the question wants to have a follow-up question, please feel free to, hop off mute and ask. I'm going through the questions as I get them, so I can't see if, you have a follow-up question coming through. But if you do have a follow-up question to your question, please feel free to just hop off mute and ask it. But the next one was, do nurses who are currently taking classes qualify for this?
Okay, so that's a complex question. So if you already have eligible student loan debt and you're already a nurse, and let's say you're continuing your education, going for more of a specialized thing at the same time, you can still enroll as long as you are currently a nurse working for a nonprofit and you have at least $20,000 in eligible student loan debt. If you have less than that, or if you're not employed as a nurse right now at a nonprofit, then you currently um, cannot enroll in this program.
And then I see the next one is just another question about the local health departments. I just confirming that local health departments are eligible sites, correct?
Yes, they are.
Perfect. And then our next question. So as an employer, our question, I'm reading exactly as I've gotten it. Our question was, a portion of the application stated that the employer is responsible for notifying the program if an employee leaves during the duration of the program. We do not have a way at this time to track this. What are your thoughts or ideas on this issue?
Okay, so this is from the employer standpoint, correct? And
I
they're
believe so, yeah.
asking about their obligation. Yes, so that is something that we require. The employer needs to let us know, the NLRP office, if a person is terminated or leaves, if they are an awardee for this program. And as for how they are going to signal that within their own system, that is something that they would have to work out internally.
Cool. Our next question. So if there's a nurse working with a sub program through an FQHC, does that fall into a priority group or would it have to be a sud clinic?
Can you say that one again? Sorry, Kira.
Yeah. So if there's a nurse working through an SUD program at an FQHC, would that fall under a priority group or does it have to be at an SUD clinic
I
specific?
see. Are they contracted out then to work at an SUD, but they're employed by the FQHC?
I'm not sure. Lindsay, do you want to pop off mute and ask?
No, it's an SUD, excuse me, it's an SUD program within an FQHC.
Okay, so it still is an eligible practice site because of the nonprofit status, but it wouldn't necessarily be a priority unless it falls within one of the other counties that are mentioned as a priority. Being an SUD clinic alone is not a priority. It would just be if you're a tribal SUD clinic.
Our next question. So we have they're reading off of the site. So the applicants must have sufficient eligible debt to warrant an initial 2-year, $20,000 loan repayment agreement to participate. So the question is, does this mean that the applicant currently needs to have $20,000 or more debt to qualify? Debt less than that does not qualify, correct?
That is correct, yes.
Yes, perfect. And then our next question was, is there an income requirement?
There is not.
Wonderful. We were looking for Juliet's email, so just if you get a chance, Juliet, to pop your email in there, that would be great.
Yeah, I can do that. All right, I dropped it in the chat, but I will speak it as well. It is russoj@michigan.gov, and I apologize, my last name is long. It's ROUSSEAUJ@michigan.gov, and you can reach me. I'm trying to get back to everyone's emails and questions within 48 hours.
We did get a question about the login directions. Is there a way that can be um, dispersed, like to the masses. Julia, is there a way I can do that to help, or do you have any ideas for that login directions?
They are available online on our website, but I can send them to Kira if you have the ability to kind of send that to everyone in the meeting, if that would be beneficial.
Yep. Yeah, we can do that. We can follow up with everybody who registered for this as well.
Perfect. Yeah. And that just that isn't for the employers. They don't need to do that. That would just be for the applicants.
And then our next question, so any idea how much funding has been allocated for this program?
Ooh,
This person has applied for similar programs with no success because the funding was low compared to how many people applied to it.
yes, yes. And that's always I guess part of the risk is funding might not be there. So there is a little over 9 million. It's a silly odd number. It's like 9,165,000. So I just say a little over 9 million, which means if let's say everyone has the minimum amount, like $100,000 in debt of student debt. So that means everyone would get a $20,000 award who's eligible. That means I can potentially award if everyone has the minimum amount around 400 to 450 awardees over this across the state for this 2-year service agreement.
So
Um,
this will be competitive.
this is very competitive, yes, because we've already received over 600 applicants. Now, bearing in mind that doesn't mean that their applications are complete or anything like that. So I do still encourage anyone, any nurse who's full-time who works at a nonprofit and has over $20,000 in eligible student debt, I urge you to apply. It does help if you're in a priority because those are considered first. But again, that's not to say that someone that's not within a priority wouldn't get awarded if they have a complete application that is extremely beneficial.
And Juliet, correct me if I'm wrong, 312s counts as full-time for this.
Correct. So if your employer considers you full-time, then we are considering you full-time. I know initially our blast that we sent out had the 40-hour for 52 weeks a year. We're not eliminating anyone who doesn't meet that benchmark. We realize that a lot of nurses, I should say, work 312s. So you won't be screened out for that. Just to be honest with your application, tell us how many hours it does ask on there, but it won't screen you out.
Wonderful. And then hopping back into the chat, then the next question was when and how do they repay the loan?
Okay, so we don't pay your loan servicer. What you will be paid, the applicant who is awarded, they would get a payment from us twice. A year into their service obligation, we will verify their work verification to make sure they're still employed at the same place where they initially applied. And then so they get one payment a year in, and then they get another payment at the end of their service obligation at the end of the 2 years. So let's say if they had a $20,000 award a year into their service agreement, after we've verified that they're still working there, they'll get $10,000. It's up to them to then repay their loan servicer. And then at the 2-year mark, they'll get the other $10,000 hypothetically that they would then apply towards their loans. So we're not paying their loan servicer, it's up to them too.
Next question. So once the paperwork is received, this is from an employer's perspective, what specifically is the employer required to complete for the employee?
Okay, so after they've had that conversation with the employee and they both decided that this is a good fit for them, then the employer would fill out the online form. It's called the practice site and declaration of intent. If you're sponsoring more than 10 people from your site as an employer, then you can reach out to me at my email and I can give you an Excel document that will make it a lot faster for you. And I'll give you a PDF of our questions as well that's on that form so that you can make a bulk submission of applicants that you are sponsoring. Does that answer that question? If not, please feel free to unmute and ask a follow-up.
Yep, I believe that was Ella. So if Ella, if that answers your question,
Um, Hi, thank you so much for that explanation. I just want to make sure from the employer side, because we have gotten a few questions specifically within human resources. So I just want to make sure, that I'm completing everything that needs to be completed for the employee. So it's
Yeah,
just
and feel
just to clarify, it'll be that,
Yep, it's
and
that
that was the
one
Part
practice
D.
site application. And feel free to reach out at any time to me if you have questions specifically about it, or if you want to set up like a quick Teams meeting. I can invite you to a meeting and we can chat about it one-on-one if your HR department wants to ask some questions and make sure they're doing it right. But it is just the one document from the employer and it has to be for each applicant.
Okay, thank you so much, Juliet. I appreciate that.
Yeah, of course.
so the next question I see on here, so if somebody has received loan repayment through the Nurse Corps, through the NHSC Nurse Corps, but they still have loans that they did not cover, can they apply for this? Can they receive?
Yes.
Okay, perfect.
So as long as you are not currently enrolled in a loan repayment program, either at the state or federal level, you can apply for NLRP. The only program that you can be simultaneously enrolled in is the PSLF, which is the statewide one. And that one's the 10 years of service type one that should be familiar to some people. That's the one you can be concurrently enrolled in. But if you're currently in NHSC and your agreement doesn't end until, let's say, next year, then you're not currently eligible for this program. You can only enroll in one at a time. No double dipping is the idea.
Jennifer, did that answer your question? Yeah, okay.
Yes.
Perfect, thank you. Next question, I see some people asking for the step-by-step guide. Once I get that, I will just send it to everybody who registered for this. So if you're here, you'll get the email with the step-by-step guide. Let's go to our next question. Do you know if Oakland County participated? I'm not sure if Juliet, do you know what this question is or no?
Are they asking if it's one of the priority counties?
I'm sorry if I say the name wrong. Florian, if you could hop off mute maybe and clarify your question.
Yeah, hi. I was just wondering if they are already enrolled in the program, if I can or if I have to ask them to.
Do you mean the health department, like Oakland County Health Department, or
Yes,
okay,
the health
perfect. Yeah.
department.
Okay, so if you are employed by your like a local health department, they still would have to fill out that form. It's per applicant. So if you've talked to them and they said that they're willing to sponsor you, then they need to fill out the practice site and declaration of intent form. No one's like pre-registered or pre-authorized. They all have to fill that out for you.
Okay, thank you.
You're very welcome.
Our next question.
I'm also seeing a couple names on the chat from people who have already applied. So thank you for your interest and your applying. And I hope we get to your questions. But if not, please email me.
Yeah, absolutely. I mean, we have about 25 more minutes that we had this. Again, I want to be respectful of everyone's time because I know we are working, but we'll get through as many questions as possible. And if you do have any other questions, feel free to, email Juliet, email me. We'll get your questions answered if we're not able to answer them right now. I see one question on here. I think I know the answer, but what if the student loans are less than $20,000? They're not still eligible, correct?
They are not eligible. We need to have $20,000 in eligible student debt. And following up on that, someone had asked about whether this is taxed once you get your award. This is not taxable. So if you've received an award from us and you get your 10,000 or 20,000, this is pre-taxed and you don't have to pay taxes on this. And that's put into legislature by President Bush, like I don't know how many years ago, but you're all set. It's already pre-taxed. You don't have to pay taxes on these awards.
And then I see a few questions about full-time. So again, if you're in your employer considers you full-time, if that's 312s or if it's more, whatever, that if your employer considers you full-time, you're full-time. So hopefully that answers any questions. I don't know if Julia, if you want to expand on that more, but I think that that should clarify anything. If it doesn't, please feel free to ask any clarifying questions we might have on that. Do you have to reapply every 2 years of the 10-year service agreement?
So if we receive more funding and we are able to continue rolling this program, and we decide to do another application cycle, you would need to reapply every on your second year. Yes.
And then what happens? So this is a good question. What happens if you are laid off?
Okay. So this is a very specific, and thank you for asking it. It's a good question. So let's say that you are part of this program, you've been awarded, and a year in, you are laid off through no fault of your own. What we would then do is we would expect you to reach out to us saying that, my employment has been terminated. Um, and we would want you to find an eligible site to finish your obligation. So, and we give plenty of time for you to do that. As long as you're currently looking, we check in with you. And then you would find a new employer and you would finish your agreement with us. So it would just kind of be like a pause, I guess, but it is important that you reach out so that we can make note of that and kind of put you on a hold until we're able to finish your agreement.
And then is there a maximum amount of repayment assistance?
So it's all based on, if I'm interpreting this question correct, it's all based on that calculation. So we can't go over the 300,000. And to be honest, we've never had that much. In our other program, MSLRP, sometimes our DDSs have, they're eligible for that program and they have a lot of student debt. Even they haven't gone over that I know of. So it's all based on that calculation, which is found online, and you can kind of see based on that what your award amount might be. So it's your amount of eligible student debt up to 300,000 divided by if you're a normal practice site, it's divided by 10, then times 2. If you're kind of seeing what you're doing your own calculation at home and want to see what your award might be like.
Is there a flyer to send out to employees explaining the program?
Everything is available online. So if you go to michigan.gov/NLRP, I would encourage the applicants to read all of that. They're going to need to know all the ins and outs of the program in order to be eligible and apply. For employers, there are a couple pages that are really specific to employers on that web page. So I'd encourage them to read all of that first. But
And
there
then,
isn't like a quick brochure to hand out, no.
sure. And then Jenny, I don't know if if you're on this call, you're probably a part of our subscribers for our newsletter. But in our newsletter, we do have stories about the nurse loan repayment program, both in our main newsletter that gets sent out, and then as well as our rural health clinic bulletin. So if you're in either of those, there's a story with a link. Feel free to forward that to anybody who might be interested in it. There's a summary of the program with all of the pertinent links that they might need. So you can definitely send that off to any employees who might be interested in this program as well. The next question I see is if the county you work in is not part of the priority index, does that automatically exclude eligibility?
No. So as long as you're a nurse working full-time with 20,000 or more of eligible student debt, you can apply. Priority just bumps you up to the top. You'll be reviewed first. You potentially get funded first. But it doesn't exclude you from eligibility if you're not in one of the priorities, like those 21 counties we mentioned, or if you're not one of those prioritize practice sites like the tribal health clinics and SUD clinics or things like that. It just makes you not a priority. It doesn't make you not eligible.
Also see some questions. These probably were sent in before we talked about this, but yeah, I'm just going through the order we get them. Some questions about taxes. So you do not have to pay taxes on the money received towards the loan, correct? It's already pre-taxed.
Correct.
Correct. Perfect. So what should someone do if they sent in an application with their My Login for Business username?
So you're saying they made a profile in
I think so. I think they made a business username for the My Login. Ian, if you want to hop off, maybe uh ask it. I can only ask
Ye-
what I see in the chat. Sorry.
yeah, so I work at a health department and we access MDSS with my login for business. And that was the username that I put on my application. And then we just said that we need to make a personal one. So I'm just wondering, should I just resubmit it with the personal username?
So you already, just to make sure I'm understanding, you already submitted your Part A, it sounds like, your online
Yes.
form, and you already had a My Login for business. And did you already upload your Part B?
Um, I I don't know what part A and part B refer to specifically, so I'll
Okay.
have to figure that out.
So your Part B is the form that you fill out the first half of, and then you send it to your loan servicer so that they can complete it. And
Okay,
once you
no.
receive that back, that's what you upload through that file transfer area.
Oh, okay, got it. So on part A, I put my so in part A, I put the wrong username and
You put your
I
business one.
haven't gotten part B back. Yeah, I
Okay.
put my business one.
So, what I would recommend, just because this is for a personal reason, not for any of your business work that you're doing,
Hmm.
I would make a personal My Login through the file transfer application, and then just send me an email with that new one that you want, and I'll replace it on your application so
Oh,
that when
okay,
you
great.
do upload your Part B, which is from your loan servicer, um, I'll be able to pair it up, and it won't be mixed up with your business dealings then, okay?
Okay, thank you.
Yeah, of course.
So the next question I see is if you could give an example of what a rural practice site is.
So this is a great question for Kira, actually.
Yeah, yeah. So we're talking about certified rural health clinics. Correct, Juliet, it's got to have that specific RHC designation for
Correct.
priority.
Hmm.
Perfect. Yeah.
Yes.
So, I'm sure if you do have a RHC designation, you're aware of that designation. And it's again, not to say that any other practice sites that might be in rural Michigan without that designation can't apply. It's just that priority eligibility is going to come from that RHC designation.
Right. So if you're in another, what you would consider a rural clinic, but you don't have like the designated RHC, then you can still apply as long as it's for a nonprofit, and you meet all the other eligibility. You just won't have that priority to bump you up at the very top. But again, as long as we're hoping to fund like between 400 and 450 people. So that's that shouldn't discourage anyone from applying.
Brooke, does that answer your question? Yeah. Okay. I hope so.
Yes, sorry. I was trying to
Okay.
find mute.
That's okay. Yep. So yeah, just that if you have that rural health clinic designation, if you are the employer or you're an employee, you can find that information out if you're an employee. I'm sure if you have that designation, you're probably already aware that you have that designation. But if you don't, please feel free to ask, and we can help you figure out if that's something that you do have.
Okay.
Yep.
The term critical access hospital and rural health clinics kind of mesh sometimes, so I didn't know if it was all one or if it's specifically um, RHCs, rural health clinics.
Yeah, it's specific to RHCs this
Okay.
time. I know they do sometimes kind of bulk those together.
Thank you.
Perfect. And then, so does a tribal clinic meet priority on its own, or does it have to be there have to be an SUD clinic associated with that tribal
Nope,
clinic.
if you're a tribal clinic, you are already a priority as well.
So the next question, I'm not sure if I understand. So if Tiffany, feel free to jump off mute and ask, but does an income-driven repayment plan affect eligibility?
Oh, I can answer that. I know
Okay,
what she's talking about.
perfect.
So if with your loan servicer, you're in one of the income-based IBRs, I think they call them. If you are participating in that, that does not affect your eligibility. As long as you are not in default with your student loans, then you are A-okay. You can have income-based repayment plans with your loan servicer, and it will not affect your eligibility for NLRP.
This is what I keep.
On mute. I'm sorry. This person just wanted to confirm that the employer and the applicant have to submit applications, correct?
Correct. So the applicant has a Part A, and that's just a normal online form that you can access from our website. And they have a Part B, which they fill out the first half of, and then they send it to their loan servicer, who completes the rest, and they'll send it back to them. Once the applicant receives that back from their loan servicer and it is complete, they will upload it through what we call our file transfer application, which is what people have been talking about through the My Login. The employer has one online form, which is called the Practice Site and Declaration of Intent form. And if they have over 10 people that they want to sponsor, which is fantastic, they can reach out to me and I will give them an easier way to do those bulk submissions.
Perfect. So then the next question, so is on application A, question 31. They don't see local health department listed as priority status. So will their application be evaluated as priority if it was left blank?
I'm pretty sure it's on there. That would be weird if it wasn't. It does kind of adjust things. So I wish I could just look, but our forms are interactive. So as you answer questions, it adjusts to what it's giving you. So if you, for type of sponsoring agency, you're going to put local public health. And so that would already show you what type that is. So you would be all set because we've kind of um, weeded you out into a priority by that question.
Michelle, did that clarify anything for you? Yeah. Okay, I'm gonna assume it did. So the original email that this person used to register for the webinar disappeared by accident. It's not in the deleted emails. So I'm reading this out loud for the first time. So I will make sure that everybody gets the new link. Hopefully that answers that question. So the next question, this person verified the fax number, called and they stated they sent it to the right place and could take back up to 10 business days to receive it back. Just an FYI. I believe this is for the loan provider, Angelita. Am I correct in stating that or no?
Yes, that is, I think, what she's referencing. So when she faxed her Part B to them, they're giving a blanket response saying 10 business days to receive back. And that is an important thing to note. As an applicant, we recommend people start with their Part Bs, which seems counterintuitive, but it makes sure that all parts get done. And that's the one that goes to your loan servicer, back to you, and then you upload. Um, you won't be able to complete your Part A unless you've at least started the process for your Part B, and that's done intentionally so that everyone's aware of it. That is true. Some of them say they take about 10 business days. Um, some of them take it by email, some of it take it by fax. You just have to reach out to your individual loan servicer, and see what they request.
And the application cycle ends on June 6th, correct?
It ends on June 4th.
Oh, okay.
And I recommend that everyone be registered for that file transfer application where you upload your Part B 2 days beforehand. That gives us time to approve your area registration, your profile, so that you can upload your Part B. So I definitely encourage everyone to apply who thinks they're eligible and to do so sooner rather than later. And I can mention this now. So after priority people, we then are sorting people by batches. So if you applied during the first week, then you're batch one. If you applied during the second week of our application, then you're batch two, and we're going to be reviewing people in that order. So there is a potential that someone would get funded if they applied during this week versus the fourth week, just but based on that, if they're not a priority. If you apply during the fourth week and get everything in and complete and you're a priority, then that supersedes everything else.
Our next question was eligible loans means that they have to be for the loans have to be for the nursing degree only, correct?
I have no way to see that. So if you have student loans, then we consider that is what brought you to nursing, and any education helped you towards that. So there's no way for me to see what your student loans were for. For loans to be eligible, they have to not be in default. They have to be, sorry, my brain just went off track. I think I need lunch soon too. Um, so they have to be not in default and they have to be in the applicant's name. So that could be a federal loan, like from Department of Education, um, or it can be a personal loan that you used. But it cannot be one that, let's say your family helped you out and they took out a loan and signed in and gave you the money. That is not eligible. It has to be in your name, student loan, federal or private, and it has to not be in default.
I think that's
For
great
more than
information.
20,000. Sorry.
No, yeah, no, I think that's great information to have for sure because correct me if I'm wrong, but the money does go directly to the applicant, right? It's not going to, a third party.
Correct.
Yeah.
So I'm not sending it directly to the loan servicer, which is why your Part B form is so important as an applicant. It's verifying that you have these loans and that they are eligible and that they're more than the 20,000. That Part B is very, very important. And so um, it will really make sure that you're put up there at the top to be evaluated for this program if you're able to get your A and B in and your employer gets the practice site and declaration of intent form in.
And then just to confirm, employers will be notified once the practice site declaration needs to be completed by the employer, correct?
I will not be notifying them. That's why it's important that the applicant talks to their employer first off to make sure that this is a good fit for both of them. I do not reach out to the employer after I receive an application asking them to fill that out. That's something that needs to occur between the applicant and their employer.
Okay, and then Kristen, I can answer this question. Yeah, so if you're registered for this program, or sorry, for this Lunch and Learn, not the program, if you're registered for this webinar session, I will make sure you get a recording of the session, and then if there's any additional email addresses that want to get it, just send me an email directly, and then I can make sure that email address is added to the list. But yes, if you're in this, I will send you a recording probably tomorrow. So the next question will be if we are accruing more loans while still furthering, what if they're accruing more loans while they're still furthering their education? Will those be considered, or is it only loans that are put on the Part B of the application?
It is only the ones that are verified on that Part B by your loan servicer. If we do have any subsequent sessions of this, like in 2 years, if there's further funding allocated for this, and you want to reapply, you would send in a new Part B, and then it would be adjusted on that award amount.
And then just to confirm again, if somebody puts down public health organization for the sponsoring agency in Part A, they will be considered a priority.
Correct.
Correct. Cool. And then another question about your part-time, full-time status. You have to be considered full-time by your employer to be eligible for this. But if 312s is what is full-time for your organization, then that counts as part or full-time. But if you are considered a part-time, you are not eligible, right, Juliet?
Actually, can we go back to, I think it was Ian who asked that question. It'll say type of sponsoring agency,
Oh.
and that's local public health. I think in his question, he just said public health organization. I think it specifically says local public health.
Okay. So local, it's got to be local.
Right.
that was not an option.
It's for the applicant on or for the employer, are we talking about?
For the applicant for Part A.
Okay, on the employer one, which kind of helps us double check everything, that is an option.
Oh, okay. So that,
So you'll be covered one way or the other.
okay. Got it, got it.
Yep, thanks so much.
And then, yeah, Julia, if you could just, because I don't want to give any bad information, confirm that if your employer considers you full-time, whatever that might be, if you're considered full-time, you're eligible, and if you're part-time, you're not.
Correct.
Correct. Okay. And then so if somebody is denied, will they be given a reason or are they just denied?
You will receive indication about why you were denied. This process takes a long time. We don't want to screen someone out. And be incorrect. So we are very particular when we do our pre-screening, screening, and review process. So it does take a long time. You're not going to hear back from us right away from the NLRP office. It's going to be several months down the line, but you will receive notification whether you are awarded or whether you were screened out, and you will be given a reason why. So that can be helpful if we do have a subsequent time that we're able to run this program again, then you'll be able to correct that mistake or see that maybe you weren't eligible to begin with.
And then a good follow-up question for that would be, when will the applicants be notified if they are chosen?
It'll be several months down the line. I think we say something like 8 in our guidance, but it can be quite a while. We want to make sure that we're thorough when we do our reviews and that we're not inadvertently screening someone out who should not be, or vice versa.
And there's been so many applicants, so to go through those all thoroughly, yeah, I would say that will definitely take some time for sure. If somebody has loans with two different servers, would they need a Part B from both?
Yes, you would want to send a Part B to each of the loan servicers.
Okay, that's the last question I see in the chat. Does anybody else have any other questions they'd like to ask? Now is a great time to ask.
I will drop my email in the chat one more time just because I know that they can kind of get lost amongst the shuffle. But it's rousseauj@michigan.gov, ROUSSEAUJ at michigan.gov. I am currently handling all of the questions coming in about this program, so I do request that you be patient, and it can take up to 48 hours to receive a response just because we've had such an outpouring of interest in this program and we're really just embracing everyone's enthusiasm about it. And that did come up actually. People applied early before the application cycle even opened. And just so everyone knows, you will not be screened out due to this. We've decided to embrace everyone's enthusiasm, and you'll be screened as if you submitted it during batch 1 during week 1.
Perfect.
I have a quick question.
Yeah, go for it.
This is Janine. I work for Jackson County Health Department. I don't know if they are part of this program. I guess I have to ask them. But I you said that this program, we will have to start working for that non-profit organization this October, start counting the 2 years, but we won't even know if we are eligible until about 8 months after we apply, right? Not if we are eligible, if we are chosen.
Correct. So, um, as long as you would be working at that practice site that or employer that's decided to sponsor you by
Mhm.
October 1st, you would be eligible. I'm not quite sure if that answers your question.
And I will start counting this October towards the 2 years. Well, I've already been working for them for 4 years and 4 months, so.
Correct. It
Yeah.
is not retroactive. It's going from the time you sign the service agreement to stay with this program for the 2 years starting on October 1st.
Well, I guess I'm not understanding it. If I have to start working for them this October 1st, 2025, but I won't know if I am chosen to get the loan until maybe 8 months later. But you won't start counting it this October, the 2 years?
It would start like even if it's retro like okay. So this is hard to describe. So we would be start the contracting process and you'd sign an award agreement before um October 1st. And that's when your agreement would start.
Yeah, I have one question. Oh, sorry.
Okay, thank you.
Excuse me, I have one question and I have to go. My name's Kelly Engel, Director of Nursing at Bergen County Memorial Hospital. We are super geographically isolated up here. We've just had the next closest hospital to us close. We're critical access. I was curious how the counties were chosen. We would be Bergen County up in the Upper Peninsula of Michigan. How are the priority counties chosen, and is that anything that I could put some input into for my nurses?
Those priorities were based on a social vulnerability index. And it's gave us the top 21 counties that had that at risk. Um, and
Okay,
what
so there
county
isn't
did you
any
say you were
input for
in?
me. Baraga?
I do not see that one listed on the social vulnerability index. But that doesn't mean that your site isn't um, eligible. You are a nonprofit, correct?
Correct.
Okay, so as long as you're a nonprofit, then you would be able to sponsor employees and have applicants from that practice site.
Okay. Okay, yeah, I just didn't know if there was any way that I could up us into a priority or not, or that, as employers, we would have any input or be able to, stand before somebody and pitch our need type of thing. We are a rural health clinic as well, but was
Yeah.
just curious.
So Kelly, because you do have that designated rural health clinic designation, you do get you are part of the priority.
Correct. Yes. If you're already a certified rural health clinic, then you would be on the priority list. There are other things that would put your applicants into priority as well. So I encourage people to look at the eligibility and priority on our website. I know it's a lot to cover within a quick lunchtime chat, but if you have further questions, reach out to me and review the materials online. And it's michigan.gov/NLRP.
Okay.
So, yeah, I want to be respectful. We're already over a little bit, but I know there are some questions that we did not get to. If you do have questions, you have Juliet's email, you have my email. Please feel free to reach out to either of us, and we will get your questions answered. And then I will also be again sending this recording to anybody who registered for this. If there's anybody else who in your practice site that wants this recording, just tell them to email me and I'll add them to the list and they will get this recording as well. But thank you so much for joining. I think this was really great, very informative. And then, hopefully we can get a lot of applicants from rural Michigan and get some loan repayment out there. So again, thank you, Juliet. I really appreciate it. And you guys, everybody have a wonderful day.
Yes, thank you all for coming today, and I hope we can get some amazing nurses sponsored through this program.
All right. Bye, everyone. Thank you.
Bye. Feel free to reach out.